Hello, I'm here to present my evidence-based protocol for a grade 2 right peroneal strain on the right leg. My name is Carson Brown. So first we're going to start off with patient background. The patient is a high school soccer male athlete, received the grade 2 peroneal strain in his right leg, and it occurred when he was kicking the ball in practice and just sudden pain on a lateral portion of the right leg. So real quick, just wanted to go over the 4 phases of rehabilitation. You have the immobilization, the progressive resistant, the functional, and the maintenance stage. So to start out with the immobilization stage, our goals are to reduce swelling by 50% 3 days post-injury, and we're going to compare that bilaterally to the left ankle. We also want to decrease pain from a 7+ out of 10 to a 4 out of 10 by 4 days post-injury. And then last, we want the athlete will be 100% weight bearing 4 days post-injury. The first modality we're going to use, or selection that we're going to use, is cryotherapy. It'll be used in all the phases, and it'll be used pretty similarly in all the phases also. So we have ice bags, or you can use Game Ready, the machine. Ice bags would just be a 20-minute treatment, preferably to where they're not up moving around using those muscles, because then that can cause some tissue heating, and then you're kind of not getting the full effects. And then there's also Game Ready, which is a compression garment hooked up to a machine that pumps cold water through the garment. For this, you would want a 20-minute treatment on the coldest setting, and since we're in a very acute stage, we want more of like a medium pressure, and then you would want to also elevate the legs. Benefits to cryotherapy are reduces in cell metabolism, causes vasoconstriction, desensitizes the nerves, so that helps with the pain moderation, and also helps reduce the swelling. Next, we're going to have laser. The most common one is a game day laser, a portable laser that the athlete can actually use on themselves. So for the parameters, we have the first principle, which is swelling and edema decrease. It causes an inhibitory response. You'll have it on mode 3 for just 1000 hertz, and you're going to use it similarly to that you would use Hivamat, in that it's going to open up the lymphatic system. So you would go at the lymph nodes, at the inguinal, and then the popliteal, and then you would go down to the lateral portion of the leg, lower leg, and you would work distally to proximally to kind of help move that fluid out. And you would elevate the leg also to help keep that flowing away from the area. And then we would use the fourth principle for pain modulation, and it would be an inhibitory response also, and you would also have it on mode 3 with a 1000 hertz setting. And this causes a decrease in the C fiber activity, so it's helping with that gait control theory. And then it causes an increase in B endorphins to help decrease the pain also. We have the effleurance massage, which is also known as a milking massage. So you would have them elevate the leg, which the best way to do this is have them lay on their stomach, and then have them flex their knee so their foot's in the air. And then you would just a light circumferential pressure from distally to proximally, and you would just use any type of lubricant, so lotion or even deep prep if that's all you had, and you would just push the fluid kind of as if you're pushing it from the foot towards the knee, and it's helping keep that fluid from settling in there and just sitting in, and it'll make sure to elevate the area for full effects. For the next stage, we have the progressive resistance stage of rehab. In this, we want to increase eversion range of motion from 0 degrees to 10 degrees, 7 days post-injury with thermotherapy and stretching combined. Next, we want to decrease pain from a 4 out of 10 to a 1 out of 10, 7 days post-injury. Then we also want to decrease swelling by 85% compared bilaterally to the left lower leg in 9 days post-injury. For this, we're also going to use cryotherapy for the same reasons we would use it in the immobilization for pain modulation, also to help reduce swelling. But the pain would be more for soreness because of the rehabilitation exercises they're going to be doing are going to be a little more strenuous, and they're going to be using those muscles in a way they haven't used them since the injury, and so they're going to be a little bit more sore. So you're kind of going more for soreness, not for immediate acute pain. Next, we have thermal therapy. So with this, we have moist heat packs, and also you can use an electric heat pad. There's also other things you can do with a paraffin wax dip, but with the area of the body we're working with, it's not a very logical choice. So parameters for this are, you'll pull the heat pack out of the hydroculator, and you'll place it over the affected area and just have it there for about 20 minutes for full effects. You want to let that patient have a towel or something they can use as a barrier between the heat pack and their skin in case it starts to get too hot, because it can actually burn the skin. And it is best to actually stretch after using the heat pack because it increases the elasticity of the muscle fibers, and then you can actually increase the range of motion more when you use a hot pack and then stretch than just stretching alone. And then benefits to this are a decrease in muscle spasms, increase in tissue elasticity, and then causes vasodilation and increases blood flow, which causes even further tissue heating. Next, we have ultrasound. For this phase, we will ultrasound in this to work on pain modulation and also increase the range of motion. Parameters for this for pain modulation are 0.5 watts per centimeter squared at 3 megahertz. And with this, we're just doing some moderate tissue heating, just working on the area, kind of tapping into the gate control theory. And then with the increased range of motion, it's more of a vigorous tissue heating. We're going for a 7.2 degrees Fahrenheit, and we're working on those more deep tissue with that 1 megahertz. Petrissage massage is different from the effleurage massage. It's more of a kneading action. It's a little more of an intense massage. So this is going to help increase the blood flow and create tissue heating. When you do this, you can pair it with things like stretching, and you can also work on the range of motion in an area. It's very good. It helps improve that elasticity in the area, and then it can also help with soreness and pain. Electrical stimulation. In this area, we're working on kind of muscle re-education, and so the best for this would be Russian mod. And so parameters for this would be a duration cycle of 10 on, 20 off, which means for 10 seconds while the electrodes are placed on the area, on the lower leg, there'll be a 10-second muscle contraction, and then 20 seconds of relaxation, and it'll go in that cycle you would want to go for 8 to 10 minutes. And then the intensity on this depends on the patient for when they start to get that muscle contraction, when they start to feel those pins and needles in that area. For the functional stage of rehabilitation, we want the patient to be able to perform 15-yard sprints at 75% effort with no pain 12 days post-injury. Patient has a pain level of 0 out of 10, 12 days post-injury. Then also we want the patient to have full eversion range of motion in the right ankle compared bilaterally 13 days post-injury. And in the functional stage, we're looking more to do sport-specific activities and work him back into his sport. With cryotherapy, again, we're just going to do the same parameters as we did before, still working more towards soreness, and by now we should have pretty much all of the swelling out of the area, so you're more just doing soreness after a workout, after a rehab exercise for the day. With thermal therapy, we're going to do the same parameters as we would in the last stage, or in the last phase, where you're going for tissue relaxation, and elasticity increase. And so we're going to keep working on that range of motion, keep improving it, getting them back to full range of motion for that E version. With laser, we're going to go with the parameters of the principle 6, which is for range of motion. It's an inhibitory effect, and you would set it to mode 3 for 1,000 hertz. And what you do for this is you can have the athlete apply it, or you can apply it as the clinician. And so you go to 3 to 4 different spots on the joint line for 1 to 2 minutes at each spot, and then you can go to different joints within the area. So we would be mainly working with just the ankle, so we would go to 3 to 4 spots on the ankle for 1 to 2 minutes each. So this would be about an 8-minute treatment. And then we also have the principle 7 of functional strength that we could use, which would be a stimulatory effect, mode 1, and we would set it to 50 hertz. For the maintenance phase of rehabilitation is they're pretty much through all the rehab, they're healthy, they're ready to go, and you're putting them full participation back into the sport. So we want the patient to be able to complete a full practice with no soreness, no pain, no complaints, 15 days post-injury. We want the patient to have a 5 out of 5 with a manual muscle testing of the peroneals compared bilaterally 16 days post-injury. And finally, we want the patient to be asymptomatic for a minimum of 3 weeks post-injury in the area. Finally, cryotherapy, we would use it just like we did in the other phases. You aren't really going to change that. You might have them maybe do a slush bucket instead, but really you would keep the parameters all the same, and you're still going for that soreness that you're trying to decrease right after practice, or maybe anything along those lines. With thermal therapy, you're just going to, again, do the same thing as you would in the previous stage, work on that range of motion. It can also help with any type of soreness and pain, and then you can pair it with other stuff like massage or stretching to help increase range of motion. With the massage, in this phase, massage would be mainly dealing with occasional soreness. So overall, in the maintenance stage, you're really only ever dealing with soreness because they should be fully back participating 100%. And so you shouldn't have that intense pain anywhere, and they should, have full movement and be, 100%. And so you can actually use a couple different massages with this. Trigger point massage, although with the area that you're dealing with, the peroneals aren't a large enough muscle to really worry about doing a trigger point massage. And then you also have petrissage, and you have the after massage.